Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we're going to be going over one of the most common root causes of recurrent shoulder pain, the anterior upper arm malposition, and what you can do to correct it. So the anterior upper arm malposition is by far the most common reason for upper arm malpositional problems and pain in the shoulder. Basically, the problem is the upper arm is not positioned centered in the shoulder socket, but is moved slightly forward. If you can see that on my body, a slight forward motion. You want to make sure before you test for this on yourself that your shoulder blade posture is in good alignment. If you're not sure how to analyze that, we have a free analysis on either the Posture Size website or the Pain Free and Fit website. So once you get your shoulder blade in proper alignment, you want to test this by using your fingers on the front aspects of your shoulder. Keep your elbows down to begin. As your elbows are raised up, you should notice a normal movement downwards of both of the arm bones under your fingers. You may feel some hardness in the anterior deltoid muscles as you come up, but there shouldn't be any hard mass underneath that moves up into your fingers. If there is, it denotes that you have an anterior upper arm malposition. Now you can switch hands and go back and forth, so one hand is on top and then the other, and think about, do you feel symmetry from side to side, or is one side moving more forward into your finger? In this case, I can feel that on my left hand side. And what that is showing me is that as my arm is coming forward, that upper arm is not being centered in the socket. It's actually moving forward. And that's one of the most common reasons for shoulder pain related to a upper arm malposition. So the correction for this is in the same position. We want to make sure that we are moving our shoulder back in the socket. Now I'll show you that on this side is very slight, maybe 1/8 of an inch. Again, I'm not moving my whole shoulder blade back. That stays in good alignment. I'm just tensing my upper arm bone backwards. It'll be easier to do this if you keep your elbow a little bit more forward than straight at your side, because as the bottom of the upper arm is forward, it accentuates the normal backward movement of the top of the arm. So again, there's that little motion of upper arm moving back. So I want to do that as I palpate or feel the front of the shoulder, and I want to emphasize that as I raise my arm up and practice that backwards movement as I raise my arm sideways. The most difficult position for this to be held in the correct alignment is when you move your arm behind you, which is when you're pulling things, chinning, rowing, pull-ups, whatever you're doing where the elbow is coming behind, you'll need your greatest pressure backwards. Again, try to localize that to the upper arm and not the shoulder blade. With practice, you'll be able to maintain a anterior upper arm correction with forward, backward, sideways, and even overhead movements. It's important you get this down. It may take weeks to months to eventually go all the way overhead or use resistance when you're doing your push-ups or your rows or even a plank, Pilates, or yoga position. You want to be able to maintain this with all of your motions, because without it, again, you're only strengthening dysfunction. If you've identified that you have this problem and can correct it with all your exercises, you'll be strengthening the proper function of that shoulder, the proper alignment in the socket, and that'll maintain a happy shoulder that'll keep you out of pain and injury.